Everyone, my name is Macy Arthur, and today I'm going to present to you about heart disease prevention. One of the main issues that nurse practitioners face is disease prevention. Heart disease is one area that nurse practitioners must spend a lot of their time educating on. Many studies have shown that heart disease can be prevented with careful diet adherence. Some evidence behind this issue is heart disease is the leading cause of death in the United States, and that comes from the Office of Disease Prevention and Health Promotion. Also, the Office of Disease Prevention and Health Promotion says that a healthful diet also helps Americans reduce their risk for many health conditions, and individuals that are at a healthy weight are less likely to develop chronic diseases such as high blood pressure and dyslipidemia, also type 2 diabetes, heart disease, osteoarthritis, and even some cancers. A few more bits of evidence include that according to the CDC, heart disease is the #1 leading cause of death in women in the United States, and being overweight with poor diet choices and the use of alcohol increase your risk for heart disease. The first study that I looked at when researching this issue of heart disease prevention was primary prevention of cardiovascular disease with the Mediterranean diet, and this study was by Estridge et al. It was a randomized controlled trial in which the participants were placed into a regular diet group, which was the control group, an intervention group 1, which was the Mediterranean diet with extra virgin olive oil, and the intervention group number 2 was a Mediterranean diet with nuts. The sample size was 7,447. The inclusion criteria included that participants must have had no cardiovascular disease at enrollment and have had type 2 diabetes or 3 of the following. They must have been a smoker, must have had hypertension, must have had an increased low-density lipoprotein, or they must have been overweight or obese, or have a family history of premature coronary heart disease. Follow-up was done through this study by questionnaires and contact with participants, as well as medical records and consultation of the National Death Index. The way that this study was followed up on to see of the effects that it made was by looking at the number of cardiac endpoints, which included myocardial infarctions, strokes, deaths from cardiovascular disease, and deaths from any other illnesses. This study found that the number of cardiovascular events were lessened in persons that followed the Mediterranean diet that was supplemented with either extra virgin olive oil or nuts. Strengths of this study included a large sample size and the randomization of the groups, and then limitations included the attrition rate, which was the dropout rate. There was many people to drop out. The changing of the control group midway through the research, and being done on high risk for heart disease patients and not being theory-based. They also did not strictly monitor what patients ate. They trusted patients' word of mouth that they followed these diets. Another study that I looked at was by Fido et al., and it looked at the effects of the Mediterranean diet on heart failure biomarkers. It was also a randomized control trial. Its sample size was much smaller, only 930 people. They also had the same control groups and intervention groups. Control group was the low-fat diet, and the intervention groups were either Mediterranean diet with extra virgin olive oil or the Mediterranean diet with nuts. To be included in this study, they had to have either type 2 diabetes or 3 or more of cardiovascular disease risk, which included being a smoker, having hypertension, dyslipidemia, obesity, or a family history of cardiovascular disease. The subjects chosen for this study were from Spanish primary care centers, and the outcomes of this study were to look at cardiobiomarkers, which included proBNP and lipoproteins. This study found that individuals that follow the Mediterranean diet with either extra virgin olive oil or nuts reduced their BNP compared with those who just followed the low-fat diet. Strengths of this study were the attrition rate and sample size, a smaller sample size, and then the attrition rate or dropout rate was 0. Limitations of this study included that it was not generalizable to all populations due to it being done on a primary care center in the Spanish community, and that there was no guarantee that these patients followed their diet plans because it was, again, just done by questionnaires. And in the first phase of this trial, the control group did not receive personalized behavior intervention, as did all the other groups. So the point of this is to improve practice for nurse practitioners. If these studies were implemented into nursing practice, deaths could potentially be reduced. Also, the number of hospital stays and doctor's visits could be reduced. The goal of Healthy People 2020 is to attain high-quality lives free of disease and injury and to improve and promote the health of all groups, and this could potentially be met. One intervention that I would like to propose would be to implement the Mediterranean diet into practice. One area that could benefit from implementing the Mediterranean diet into practice would be Harlan County, Kentucky. They have increasingly high rates of heart disease, and according to the DHDSP, their hospitalizations per year are 97.3%. ARH Medical Associates in Harlan County would be one place to implement this in practice. I really hope that you have enjoyed this information on primary prevention in cardiac disease. I think this is something important for nurse practitioners to implement into practice. If you have any questions, you can post in the discussion board, and all my references can be found in the PowerPoint.